Welcome to Plus Talk on Plus Life. I'm joined by Dr. Charlene Flash today. She is the president and CEO of Avenues 360 Health and Wellness in Houston. And we're talking PrEP and pregnancy. Good to see you, Doc.
Good to see you, Carl. Happy to be here.
Thanks for making the time. Let's dive straight in. What is PrEP?
PrEP is HIV pre-exposure prophylaxis. So what that means in English is PrEP is a medication that people can take to protect them from becoming infected with HIV.
So like right now, condomless sex, right?
It can be with a condom or without a condom. Okay. Taking PrEP doesn't drive your condom use, but it does drive your ability to protect yourself from HIV. And right now we have 3 options, 2 different pills and 1 injectable.
How does it work?
So that's an interesting question. Basically, PrEP takes medication that has historically been used as part of HIV drug treatment cocktails to create a barrier of protection for individuals who are at risk for HIV, to protect them from becoming infected. The mechanism of action isn't totally clear, but we know that when you give this medication to thousands and thousands of people that are at risk, and you give a sugar pill to thousands of people who are not at risk, the people who are on PrEP are protected from becoming infected with HIV.
So let's talk from a female's perspective. You can do that better than I can, obviously, because I think we hear PrEP a lot. People think, oh, it's for gay dudes predominantly. I think it's been marketed a lot like that, you know. But if I'm a female in a serodiscordant relationship, that is to say my partner is positive and I'm negative, is PrEP a good idea for me?
It can be. And so when I think about people who are in a relationship or people who are about to engage in intercourse, I try to stay away from discord, because that's never good in a relationship. So I think about them as serodifferent couples. And so when people are serodifferent and they're looking for options on how to protect them, some of the medications that can be used as PrEP are available to women, not all. So there are 2 different by-mouth pills. The older one can be used for women. The newer one, we just don't have the data yet.
If I'm wanting to get pregnant and my partner is HIV positive, again, I'm speaking from a female's perspective here, can we, and is PrEP a good tool in that?
All right. So if a woman is with a sexual partner, a male sexual partner, and she says, gosh, you know, I really want to get pregnant. Is this even an option for me? Absolutely, yes. We have lots of women who are able to not only get pregnant, but safely get pregnant such that they don't get infected with HIV and their baby is not infected. So those are the really important criteria. So there are different ways to go about this. Now, you can do it the old-fashioned way, which is 1, make sure that your sexual partner is on treatment himself, that his level of virus is completely controlled, so at an undetectable level, and that he's actually continuously taking his medication. So you don't want to see lab results from like 2 years ago, right? If you're trying to make the baby right now, you want to see his lab results from right now so that you know that his level of virus is well controlled. And then in those settings, though often we encourage people to use condoms to protect them from syphilis, gonorrhea, chlamydia, that doesn't work if you're trying to make a baby, right? And so we want to make sure that your sexual partner has no circulating virus so that you guys can make a baby and not worry about you getting infected or the baby getting infected. Now, the amazing thing about PrEP is you now have additional options as a woman, so you don't have to trust, is this guy really taking his meds? And are these today's labs, or is this the labs from 10 years ago and they've, no longer are relevant? And so PrEP allows the woman to protect herself, to have that barrier of protection, to protect herself from getting infected while she's having condomless sex with her male partner so that she can have a baby. The baby doesn't have HIV, she doesn't have an HIV, and he's taking his meds or he's not, but she has the control in her hands to be able to protect herself.
So how long should a female start taking PrEP? If this is a conversation that she's having with her partner and they want to go down this path, is there a right time to start that's better than, say, do I do it a week before, a month before? How long is typically advised?
Yes. And so for the medication that's taken by mouth to get to the appropriate drug levels to provide protection, you need at least, the science says, you need at least 21 days to get appropriate drug levels. What I tell people is start the month before, right? So you have your cycle, start your PrEP, and then, have a month pass and then try and have fun trying.
Very important to have fun trying. What about side effects? Because a lot of people talk about, oh, I don't want to put another drug in my system. Let's talk specifically from a female perspective and a female who is wanting to get pregnant. What are the potential side effects?
So the side effects are few and they are rare. The most common thing that happens with people who take PrEP is that they have weight loss without trying. And for most women in America, they would say, hey, maybe that's a good
That's
thing.
not such a bad thing.
Yeah, exactly. And so some people can have some stomach upset as well. Now, if someone has other medical problems, that can make it a little more complicated. So if I want to get on PrEP and I already have another medical problem that causes damage to my kidneys, for example, PrEP does put pressure on the kidneys as well. And so in the setting of having not totally normal kidneys, that might be a problem for the woman. And the other thing to think about is that in the long term, PrEP can cause decreases in what we call bone mineral density. So how dense or how hard and strong your bones are, which is something to think about for women because as women age and get outside of that time of your life where you're having babies and you get into that postmenopausal stage, their bones tend to thin anyway, and they tend to be at risk for osteoporosis. And so it's important to just think about, well, is there anything else that could be driving thin bones for this woman as I'm thinking about PrEP as a long-term solution. Now, just because you've decided to take PrEP as part of the I'm trying to make a baby experience doesn't mean that you have to use it forever. And so that is also a way for you to decrease or mitigate risk.
I was going to ask, once we've successfully made the baby and the baby is cooking away, do I have to stay on PrEP if I'm a woman, or can I start to come off PrEP while baby is still inside?
Great question. So you've made the baby is cooking, as you say. I really believe in shared decision making. So it really depends. Now, if this sexual partner is your ongoing partner, right? You have this ongoing partner and you are still having intercourse, because yes, people do have intercourse while they are pregnant, then PrEP may still be a good idea for you, especially if you are not navigating condoms during that time frame, or if the partner doesn't have well-controlled virus, right? They kind of get depressed, come off their meds, or whatever is happening. So PrEP may be an option for you. Now, whenever you talk about women who are pregnant taking medication, everybody freaks out and says, oh my goodness, what's going to happen to the pregnancy? Well, the good news is that the ingredients that are in the kind of PrEP that women take in this setting are also the same ingredients that we've been using for years to treat children who have HIV. And so we know that these medications, that children do well because we have lots of data about what happens with children who've been exposed to these medications. Now, what I tell folks is, suppose people have all kinds of thoughts about making babies, right? And so you start a month before, you're on your PrEP, you're like, okay, ready, here we go. And you have your try. And so maybe this isn't the kind of relationship where you are, you're living together and it's your trying every day, but it's like he flies in from the other coast. Okay.
Right.
So the other part of the question is, do I just take it up until that day and then I stop? Well, I generally tell people in this setting that you also want a tail of protection. So you want to continue after after the intercourse, if it happens to just be a kind of one try, though that often is not the best way to make a baby. You have to try a couple of times, and so during that entire season, PrEP is a good idea. Now, there is something else out there that men can do but doesn't work for women, and this is on-demand PrEP. right? So gay men are able to take a couple of doses right before they have sex and take a dose the day after and the day after that and are able to be protected. We don't have any data that proves that that actually works for women. So don't do that. So if you go to Dr. Google and he says, let's do on-demand PrEP, just 4 tablets, a couple of days before and after, don't do that. It doesn't work, and it will not protect you appropriately or protect the baby.
Dr. Charlene Flash, this has been great. Thank you so much for making the time and having this chat with us.
Oh, it was my pleasure. Thank you for having me.
If you want more information about what we've talked about today, go to the website, pluslifemedia.com. And you can always follow us on social media. We are at @pluslifemedia. Until next time, take care. See ya.